When a young Ekaterina and Igor first met in 2007 in a high school in the city of Kherson in Russia, they soon developed a romantic interest with each other and started dating. And 4 years later, which was in 2011, they graduated from high school, and by the age of 19, Igor would open his own 2 computer stores to make ends meet. And some years later, he would pop the question, and of course, Ekaterina's answer would be yes. They soon married, and the marriage was blessed by Ekaterina's beloved mother, Galina Baryshnikova. They were a close-knit family, and it showed, a family that loved each other so dearly. Just few years after their marriage, then fast forward to 2018, a now 27-year-old married Ekaterina Fedyaeva was living with her husband in the western Russian city of Ulyanovsk. Ever since she was little, she had always wanted children of her own, and now married, this was something she wanted with her now husband Igor. And since September of 2017, she had already started making preparations for pregnancy, even visiting paid clinics within the city. In one of those clinics she frequently visited, she had gone for an ultrasound where it was found out that she had developed an ovarian cyst within her body. An ovarian cyst is basically a health condition in which fluid-filled sacs form within the female ovaries, which is an organ that produces eggs and hormones in women. Most ovarian cysts are harmless and can go away on their own, but some can cause pain, bleeding, or complications during pregnancy or childbirth. Hence the reason why the head of the gynecological department within the city had recommended that in order to remove the cyst, she had to undergo a fertility surgery known as laparoscopy, which is a surgical operation performed in the abdomen using small incisions and with the help of a camera. Ekaterina, not wanting to risk it since she really wanted a child of her own and also receive birth in the event she eventually becomes pregnant, began making arrangements, even though she felt a little bit anxious about this operation she had been told to undergo. But she would eventually tell her husband Igor and her mother Galina, who supported her all the way. She eventually summoned courage and booked an appointment, and 6 months later, her date was due. It was on the Thursday morning of the 15th of March 2018 when she would go into the hospital for a routine operation, together with the company of her mother and her husband. On the day of the operation, her family had held her hands and kissed her, wishing her a successful surgery. It would be moments later when Ekaterina went into a room within the hospital to change into a patient outfit and was then placed on anesthetics to calm her. It was just moments when she passed out and was then wheeled into the surgical room where the procedure began. As the operation started, an incision was made in her abdomen, while a long fiber optic cable system known as a laparoscope, which allows for the viewing of the affected area where the cyst could be removed, was attached. Then, as the surgical process went on, a saline solution was also used to sanitize the abdomen and other internal organs to help facilitate the operation. Few hours after the operation was done, the doctors left Ekaterina in her bed, and later that day, Ekaterina's mother, husband and mother-in-law, and a few of her other closer friends and family came over to see her at the hospital. But when they arrived, she was still feeling weak in what was now seen as a successful operation. However, just within hours, her temperature began to rise dramatically. But that night, as this issue were brought up by Ekaterina's family to the hospital doctors, one of the doctors who have been involved in the operation would tell them not to worry, as it was just a minor weakness from her post-surgery and she just needed enough rest at home, and that Ekaterina should be given enough chicken soup. They also gave further instructions on how to best take care of her till she fully recovers. But just few moments after heading home, Ekaterina began to vomit violently and also developed chronic stomach pains, which threw her into a series of agonizing pain throughout the night. The mother Galina proceeded to put a sock on her feet, then a robe, then a blanket, thinking it could be cold or just a slight side effect from her post-surgery. But strangely, Ekaterina was still shivering to such an extent that Galina didn't seem to understand what was happening. She, together with Igor, then took her quickly to the hospital where she had had the operation. Immediately, the doctors began to diagnose her to see how a patient who had been with them several hours ago had just begun to suffer from these strange symptoms. But before this diagnosis began, some of the doctors in charge had earlier made a very horrific discovery as they looked at Ekaterina. And why the family didn't know what to make of this, they just held Ekaterina's hand, assuring her that she would fight through the emergency and even the surgery, which she was still yet to fully recover from. But before her family would leave the hospital for the second surgery to start, Ekaterina looked up to her mother and told her that she was dying. On hearing this at the time, Galina told her that she would be just fine, thinking Ekaterina was just being a little bit naughty. An hour later, the doctors began another surgery where they spent hours using a tube to try and flush out Ekaterina's abdominal cavity with different solutions. And several minutes after the second procedure, Ekaterina was kept under close supervision. And few hours later that day, Ekaterina's mother, husband, and mother-in-law, who had been hoping anxiously for a better response, came into the ward. But when they arrived, she was still unconscious, and the doctors would inform the family that she had a very low blood pressure. But before the family left, the doctors at the hospital also proceeded to administer drugs for abdominal pain known as Spectre, and then an injection of Ketorol, which is an anti-inflammatory drug used for short-term relief of moderate to severe pain. But that night, Ekaterina would once again go on to suffer from chronic stomach pains and vomited on several occasions. She also suffered from agonizing convulsions as her whole body began shaking violently, and moments later, she would be quickly rushed into an intensive care overnight as her condition quickly deteriorated. The doctors would then put her on life support, but even hours after being put on this machine, doctors discovered that her heart stopped beating on several occasions. And in total, they went on to inject around 52 different drugs into her body at separate times in a desperate attempt to save her from her deteriorating state. The next morning, Ekaterina's mother, Galina, and her mother-in-law, Valentina, who came over to check after the daughter, were shown the intensive care unit where her daughter had been transferred within the hospital. While standing by her bedside, looking at Ekaterina, something wasn't alright, and the mother-in-law Valentina noticed that she seemed heavy on the touch. Ekaterina's legs were moving violently from convulsions. The two women then decided to search for the doctors and inform them of what was happening, while her husband Igor was close to her, trying to comfort her. As they made their way to see the doctors, Galina and Valentina happened to look down the hallway at the hospital, only to see the doctors standing and discussing in a low tone between them, while they also seemed to be arguing something among themselves, quietly going back and forth about something between them. On seeing the women, one of the female doctor and other medical professionals then called for Ekaterina's husband Igor and her mother Galina to an office, while the mother-in-law, who was told to wait, went in to stay with Ekaterina. While inside, as the doctors talked to the husband and mother, their hearts began to pound faster, although they were not really sure as to what the doctors were trying to say. But all they knew from what they were being told was that Ekaterina, or Katyusha as she was fondly called, was in a serious critical condition. At that moment, fear of the worst flashed through Galina's eyes as she recalled what her daughter had told her some hours ago about dying. After this brief meeting, just within 3 days after her surgery, Ekaterina fell into coma as her body could no longer bear the excruciating pain it was passing through. Galina would plead and beg the doctors to help save her only child's life, but the doctors tried to either calm her or downplay the situation and urged the family to rather sign a transportation document so that Ekaterina could be transported to a more specialized regional hospital since she wasn't responding to treatment for days. On the 19th of March 2018, so 4 days after Ekaterina went under the knife for the ovarian cyst operation and just a day after falling into coma, her family quickly flew her on a special flight to a hospital in Moscow where treatment began almost immediately. But just minutes before the treatment began, the doctors at this new hospital also made a very horrific discovery, which the previous hospital had seemed to discover earlier. However, this second hospital would try their best to save her as Ekaterina would eventually wake up from her coma. But it was just for a brief period of time as she again quickly went back into coma. few days after falling into coma for the second time in this new hospital, and before these other doctors could do anything to keep her alive, all their efforts would seem to yield no result, as over the following 2 weeks, Ekaterina would go on to suffer horrific internal pains as every organ in her system continued to fail one after the other. And on the 5th of April 2018, after so many of her organs had just stopped working, she would eventually give up the ghost. With the aftermath of Ekaterina's death, after what was meant to be a successful routine surgery, Galina, the mother, and the rest of the family were so heartbroken and in severe pain. But also, they quickly began to accuse the hospital responsible for the initial surgery on being the cause of their daughter's death. And at first, this seemed to cause confusion for some people, as they couldn't understand what they meant. It was when an investigation began that the true nature of the nightmarish horror that Ekaterina had gone through would come to light. The following is the actual truth of what happened to Ekaterina that ultimately led to her death. Before you finish the video, I would like to say that if you're a lover of disturbing, dark, and mysteriously spooky true life horror stories, then you might consider doing all those lovely YouTube stuff on screen right now, as it truly helps the channel in making more videos like this. And with that said, let's get back into the story. It would turn out that during Ekaterina's surgery, as she made her way into the operating room after booking her appointment in the first hospital, the surgeons who were present to begin their duties before beginning to operate on their patient, who in this case was Ekaterina, had to make sure that her vitals were always stabilized before, during, and after the surgery, and also ensure that the surgical site, which in this case is the abdomen, was cleaned as the process went on to avoid infection. And for this to happen, they had to use a saline solution, which is normally used medically to clean wounds and for other purposes. It also has other functions, such as helping to balance a patient's fluid and blood pressure within the appropriate range. Except that it wasn't a saline solution that had been used to wash the surgical sites, but instead, they had rather used another solution for the process, a chemical solution known as formalin. Just in case you don't know what formalin is and what it does, I will tell you. Formalin is a toxic colorless liquid substance which is obtained when formaldehyde gas is dissolved in water. That is to say that at room temperature, formaldehyde is a gas, but when used in a 37% solution with water, it is known as formalin. To put it in a clearer perspective, embalming fluid, which is used to preserve human corpses by slowing down decay, has only 5% formaldehyde, and it works by killing essential bacteria and slowing down the decomposition process. But before this fluid is injected into a dead body by the morticians to slow down decay, the blood and other body fluid present in a human body are often expelled totally by the embalming fluid. However, formalin is even stronger than embalming fluid, which is also the reason why it's normally used to preserve anatomical specimens in the laboratories. 30 milliliters of this solution in human body is considered the lethal dose of formalin. And the nurse, who was present during the surgery, had continuously mistakenly sanitized Ekaterina's abdomen with what she thought was a saline solution during the surgical operation, not knowing that it was formalin, which when you think of it, was obviously more than the lethal dose of 30 milliliters. It was some hours later when Ekaterina's temperature dramatically rose just after the laparoscopic operation that a diagnosis was carried out and the nurse realized her mistake, and with the other surgeons catching up on what had happened. It would have been immediately or just after the operation when Ekaterina's body, which still had blood and other body fluids, began to quickly rupture, beginning with the red blood cells. Within several hours, this would have stopped oxygen from being sent throughout her body gradually, and in turn would have led to a huge influx of the formic acid into her body. The formic acid, which is also a dangerous chemical sprayed out by some venomous ants, would have slowly eroded each organ in her body, one after the other, gradually rupturing every organ from the inside out, hence eventually disrupting the function of nearly every living organ within her body tissues, coupled with blood circulation failures. For 3 weeks, This was the extent of what Ekaterina slowly passed through in what was meant to be a safe surgical operation. It would also turn out that after realizing their mistake, the doctors had reportedly tried to rid her body of the chemical by flushing it out during the second surgery, just after Ekaterina had rushed back into the hospital after she began convulsing. But this wasn't just a desperate move to save her life, but also an attempt to cover the mistake on their part. But it was all too late by then, as she had the toxic chemical in her system for a whole 14 hours before that desperate procedure began. Even though they should have begun to save her life immediately the initial discovery, rather than proceeding to give her some pain relief medicines and telling the family to cook chicken soup for her and a bunch of other medical advice to take care of her at home. According to a medical professional, after several hours of the chemical formalin circulating around the body, the outcome of death was fully predictable. On one of the days when the family had visited and seen Ekaterina convulsing, Galina and Valentina, who went to search for the doctors during Ekaterina's suffering, had witnessed some of them arguing among themselves. It would be safe to say that they were discussing on how to inform the family on the medical blunder that had taken place. They knew the outcome, and in a bid to avoid her dying in their hospital, they had also tried to cover it up more by calling Galina and her husband Igor into the office, where a female doctor and a bunch of other medical personnel told them that a medical mistake had taken place earlier. Although they initially found it hard to tell them the truth or exactly admit what happened or the extent of it, in fear of the issues they would have with the family, they just told them that Ekaterina was in a coma after a medical mistake and that her heart, lungs and liver stopped working, hence the reason she was attached to an artificial lung ventilator to assist with her breathing. That was just it. The family never knew that it was formalin slowly killing her, as they were never really told the whole truth. It was after Ekaterina was moved to the regional hospital in Moscow, would the new set of doctors inform the family after they had discovered that Ekaterina's body had been washed with formalin during her initial surgery and not the normal saline. This was also the reason she had also suffered the cold-like and fierce convulsive symptoms, combined with her heartbeat stopping at some intervals, which were the symptoms of having formalin in a living human system. How exactly this mistake was made was unclear at the time, as the doctors weren't eager to reveal how the mix-up happened. But later reports indicated that the nurses had failed to read the labels on the chemical bottles before it was used at the surgical site during the operation. Apparently, the unnamed hospital also had a morgue in the basement where both medical and embalming supplies like formaldehyde, which was also used to sanitize medical equipment, were stored together unmarked. There is also the documented use of formaldehyde in operating rooms in order to control hemorrhage and to denatured tumor cells. But still, even with these medical uses, some patients have also experienced serious toxic effects such as low blood pressure, a speeding heart rate, kidney failure, and even death. Even an anatomy professor who heard the story was surprised, since her death took so long, as the process would have been quicker, hence showing how resilient Ekaterina had tried to fight through the horrifying ordeal, even though her body later couldn't cope with the poisoning. After the medical blunder which led to her daughter's death, Galina would immediately accuse the former doctors of committing pure murder, as she opened a criminal case, saying, and I quote, "People who performed the surgery already knew they infused something wrong. They needed to take some urgent measures, and they knew very well that they washed up her body with a poison, and they did nothing to help. I continued begging for them to help my only child, and they had at one point told me to go home, cook chicken soup, and to stop worrying. I believe they just wanted her to get away so they could hide everything." Despite some circulating reports claiming that she was embalmed alive, Ekaterina's actual cause of death was multiple organ failure, as her body failed to filter out the poison. Following the investigation, a case of causing serious harm to human health through negligence as a result of improper performance was opened. Some weeks after the botched surgery, the head physician of the hospital would be dismissed, and 5 more medical staff members involved in the horrific mistake would resign on their own free will. Representatives of the administration of the institution that mistakenly killed her were also reprimanded, and measures of material liability were imposed. Also, All the materials of the official check were transferred to the investigation department of the Investigative Committee of the Russian Federation in the Ulyanovsk region. As for the resilient Ekaterina, who fought hard for her life, the regional government would assist in delivering her body to her hometown and also organized her funeral, as she would be buried on the 7th of April 2018, just 2 days after her tragic passing. She would be described by her family members and friends as a sweet and tender young woman who died too soon. Those who knew her would also describe her as a gentle, sweet, fragile girl who was never rude or ever refused to communicate with someone. The only thing she really wanted was a family of her own, and we hope that rather than being remembered as, in quotes, the embalmed alive Russian woman, that she should rather be remembered as a bright, kind and sweet soul she was.